This presentation will be about sexual health in a public health context. Introduction to sexual health. Sexual health refers to the combination of physical, emotional, social, and intellectual aspects of sexual relations in individuals. It is a broad term that encompasses a large array of issues in the public health and affects everyone. Sexual health is a serious topic with many issues and many possible solutions. Current research into sexual health. The World Health Organization looks into public health as a whole and also branches off into different parts of health. This includes sexual health. They have done extensive research into the definitions of sexual health, the problems they cause, the different issues with sexual health in different countries, and solutions to these serious problems. Other research into public health issues have been run by the government organisations and independent studies regarding individual issues. Medical research has come a long way, and new vaccines and forms of treatment are coming along. But to prevent these sexual health problems would minimise the extreme demand on medical researchers and improve the way of life for many individuals and communities. This is incredibly important, and research needs to be continually done on a regular basis as it will benefit the public health system in so many ways. The problems with sexual health. Awareness of sexual health, practicing safe sex and respect for individuals' consent is spread across the world, with first world countries being more informed, whereas countries with lower education and healthcare options aren't offered the information that should be readily available no matter the person. Diagnoses for most sexual health issues can be identified by a health worker, but some need referrals to specialists like gynecologists, something that some individuals don't have access to. Treatments for these issues can vary from healing with time, therapy, antibiotics to invasive surgeries. In some cases, though, the sexual disease, such as cancerous problems like cervical cancer, don't have complete cures or treatments and result in fatality in some cases, especially if access to a public health professional or a certain treatment is not offered to the individual. Impacts on sexual health. Relationships. Where consent or abuse is an issue or relationship strain has had an effect either due to or causing an issue with sexual relations. Socioeconomic factors impact sexual health through lower education levels, higher disability communities, and affordability, which affect individuals, communities, and increase the focus needed on public health policy. Income directly contributes to whether people can afford to pay for prevention options or treatments. Location can determine an individual's access to preventative and treatment means, more rural areas having less options and access. Government and country issues like government enforcing laws, and in some cases they can control the media. A country's government and political stance has an enormous impact on access to preventative measures and treatments and education levels. Society's standards. The standards a society holds can impact sexual health if unprotected sex or consent disregard or multiple partners is encouraged. It could lower sexual health. Gender can have a drastic role as some diseases affect only a male or a female, such as cervical cancer for women. Age, this can affect people. The older they are, the more sexual relations issues they can have, such as the likelihood of erectile dysfunction growing the older you are. Cultural issues. There are cultures that do not believe women to be allowed consent or encourage multiple partners, and some that believe that contraception is a negative thing. These all directly impact an individual's sexual health. Individual demands, such as unsafe sexual fetishes or preferences, which affect a person's health. Sexual preference. Sexual preferences can put certain people at a higher risk to STDs, and communities like the LGBT community may also be less advantaged due to social exclusion. Unprotected sex will transmit STDs and can result in fatalities in certain cases. Pre-existing health conditions and genetics, such as infertility issues, is an important factor as well. STDs, pregnancy, and other sexual health issues. Sexually transmitted diseases are spread through unprotected sexual relations. Some STDs include chlamydia, gonorrhea, genital herpes, HIV, and HPV. HIV progresses to AIDS, which is a serious disease that leads to immune deficiency issues, which leaves the body unprotected to many cancers and other fatal diseases. It's a really sad issue that has affected everywhere in the world in the past a lot. It's been a lot better recently with current vaccines and awareness. HPV can infect a woman and develop into cervical cancer if either individual was not vaccinated. And even with the vaccine, it only protects against certain strains of HPV. But that said, you should always get a vaccine if it's offered by a medical professional. Pregnancy issues can come from infertility, trouble with sexual intercourse, such as erectile dysfunction, or troubles during the pregnancy, such as medical conditions that cause miscarriages, or smoking, taking drugs, or drinking during pregnancy and infections. Sexual abuse and child sexual abuse are incredibly serious topics that need to be handled delicately. Issues concerning a disregard for consent in most places are punished by law, but not all countries believe a woman should also consent. This causes issues for the individual's mental health, sexual health, and can cause pregnancy in some cases. Information on the extent of the problem. Australia has a teen pregnancy health problem, which was looked at in 2017, and although it was at a lower rate compared to previous years, 2.8% of all Australian births were still recorded from people under the age of 19. Before this, a 2003 study found that abortion was the second highest reason for young women aged 12 to 24 for being in hospital for a surgery. This was very worrying, and we have since improved our contraceptive methods, sexual health classes of awareness and prevention, and laws in place to now legalise abortion on fair grounds, especially for young individuals. But the extent of the problem is not limited to only teen pregnancy. STIs are a very big issue. In Australia, the Australian Institute of Health and Welfare found an increase in syphilis and gonorrhea, with an enormous increase in cases of chlamydia over the span of 21 years. This enormous spike in cases is a massive issue in Australia and needs to be acted on with high importance. Other countries that don't have access to all the needs do not live as long and have much higher cases of STDs, teen pregnancy, and rape and sexual abuse. Public health implications of the problem. Public health implications of these problems are major. They should be put in several categories, being social impact, individual impact, and public health policy impact. Social impact. Sexual health issues can cause many problems socially, including people's relationships with each other being affected and the community. When a population of a country has had a particular view of sexual partners as more partners the happier, then that could cause issues with sexual health, especially if they don't believe in condoms. Social strains can also be placed on people's relationships through abuse and sexual consent being disregarded in society. Social issues like exclusion to certain groups can be a large issue as well, with communities such as the LGBT community being excluded due to these social beliefs. Individual impact. There are many sexual health impacts on an individual. These include mental strain from consent or a medical discovery from poor sexual health or genetics. This could push therapy to help these people to seek help. This can also have lifelong implications, where people are diagnosed with diseases that won't leave or cause death. If a person becomes pregnant and does not wish to keep the baby, there are implications of how to get rid of it or of assistance of how to live and raise this child. Public health policy impact. When sexual health issues arise, policies need to be reviewed and revised. Large spikes in STDs, rape cases, or unwanted pregnancies show a weakness in policy of education, lawmaking, or availability of treatments or preventatives. That's incredibly important to focus on in a public health system. Possible public health solutions. Health promotion. Through individuals' promotion of health persuasion, which include advertisements of sexual health options such as contraceptive methods, abortion options, and safe sex awareness, and offering personal counselling, which includes gynecologists and doctors helping inform and offer contraceptive methods and abortion options, as well as therapy offered. Through collective promotion of legislative action, so laws that have been put in place, such as purposeful spread of known STIs and anti-rape laws put in place against these, and community action. Sexual health contraceptive options need to be made available as humans engage in sexual relations either way, and without the option, STIs and unwanted pregnancies will rise and become an enormous health issue. Contraception options. These include condoms, combined contraceptive pill, which is known as the pill, progesterone-only contraceptive pill, which is the pill but without the estrogen, contraceptive implants and injections, diaphragms and caps, IUDs and IUSs, emergency contraception, such as the morning after pill, a vasectomy, a female sterilization, vaginal ring, natural family planning. And natural family planning isn't as effective as most of the others, but it's a non-invasive surgery or alternative to tablet taking. Australia's action. Abortion is now legal in all states and territories, the most recent state of New South Wales legalising it last year in 2019. Queensland released a sexual health strategy for the years 2016 to 2021 with goals and strategies of how to obtain them, including improving community awareness, information and preventative measures across the lifespan, improving education and support for children and young people, responding to the needs of specific population groups, and the service system. This also includes a lot of Aboriginal targeted communities to help spread the awareness and hopefully providing them with contraceptive methods. Australia provides people with website material to help with planning pregnancy and other options, whether to keep the child or to get rid of it, with websites for some states which provide links to more information, legal and medical sources. These are great for not only family planning, but reproductive and sexual health in general. Cultural differences. Cultural and societal beliefs, such as what I mentioned before, religious beliefs, location comes into it, government and country, so whether they allow things, like I mentioned before, and socio-economic reasons. To conclude the topic, sexual health encompasses many issues around the world. It addresses the spread of sexual diseases, consent issues, reproductive health, relationships, government policies, and many more important problems. It is a vital field of study that needs to be sustainably managed and improved for not only Australia, but the whole world. Education on all these topics is crucial for individuals to make their own decisions, and providing solutions, whether it be by laws, contraceptive methods, tests, therapy, or medical solutions, they are all incredibly essential for public health. Thank you.